And another non-dietetic use of garlic in the classical period was in fertility tests. So this is a test which is found in one of the gynecological texts, the Hippocratic Corpus, called Barren Women. And it goes like this. Another, having washed and peeled the head of garlic, apply it to the womb and see the next day whether she smells of it through the mouth. If she smells, she will be pregnant. If not, she will not. So how does it work? So the Hippocratics believed that the body of a woman had some sort of tube going from one mouth to the other. So from the mouth of the face to the mouth of the womb, which is the vagina. And if there was any blockage in that tube, well, it could cause sterility. And that's why we have those tests. So if the woman is healthy, the smell of garlic will travel from her vagina to the mouth without problem. And the passage I've presented here is only one among several describing this method. And we have things like that also in the text of Aristotle. And we also have clear parallels in Egyptian texts, but I can't go into that because it's rather complicated. In the context of sexuality, it's also interesting to note that women participating in women-only festivals, so those are festivals that happen in a lot of parts of Greece, and festivals in honor of Demeter. So Demeter is the goddess of corn, so she's the goddess of the earth fertility. So at some of those festivals, the Skira and Thesmophoria, large quantities of garlic were consumed. And the explanation given for this practice is that the smell was supposed to keep the husbands away. Well, because it's only for women, so you have to keep the men away. And a historian of the 1st century BC, Philochorus, says they ate garlic in order to abstain from sex so that they would not smell of perfume, because perfume is associated with having a sexual relationship with one's husband. However, in view of what I've just said, it may be that in this religious context too, garlic was used as a means to indicate fertility. Those women who healthily smelt of garlic were fertile women. And because this is a festival, 2 festivals in honor of Demeter, it's important to indicate that women are fertile. So I hope to have shown through those examples that ancient physicians used garlic as more than a simple food. In the case of the application of garlic to the eyes, we are dealing with what we would call a pharmacological use of garlic. But the use of garlic as a predictor of fertility is almost impossible to classify. So the definition of the Aristotelian problemata simply does not work in the case of garlic. Its professional-looking neatness does not encompass the messy reality of health-giving substances such as garlic. So this allusion to professionalism leads me on to the question of our panel, namely, who owns our health? Interestingly, in the Hippocratic Corpus, where, as we have seen, boundaries between dietetics and pharmacology, between foods and drugs, are not neatly drawn, either on a theoretical and a practical level, one can find claims that health belongs to everyone, that everyone can contribute to medicine. And this is another passage from the Hippocratic Corpus. It is worth learning from everyone about medications that are drunk or applied to wounds. Indeed, men do not discover these by reasoning, but rather by chance, and not more by experts, and the word is kerotechnai, than by laymen, and the Greek word for laymen is idiotai, idiots. But whatever is discovered in the art of medicine by reasoning, whether about foods or about drugs, must be learned from those who have discernment in the art of medicine, if you want to learn anything. So the Hippocratic authors were rightly aware of the serendipitous nature of much medical discovery, and they did not want to miss on opportunities to find new treatments coming from unlikely sources. Now, among those laymen that contributed to discoveries in the field of dietetics and pharmacology, there were women. So we know for a fact that women were responsible for much of the cooking in ancient households, and we also have sources indicating that women were active in the field of pharmacology. And in this context, it's very important to note that most of the recipes preserved in the Hippocratic Corpus are found in the gynecological texts of the corpus. So we have quite a few, in the corpus, in the Hippocratic corpus, we have quite a few gynecological texts. I think it's 10, and most of the recipes that we have in the corpus cluster in those gynecological texts. So why is that? And many scholars have suggested that there are more recipes in the gynecological treatises of the corpus than in any other Hippocratic text, because women were treated in a different manner and by a different personnel from men. The recipes preserved in the Hippocratic text are the reflection of the law of ancient midwives and housewives. However, Helen King, who's a scholar of ancient medicine, has pointed out two major issues with those attempts at finding what we call female voices in the gynecological texts of the Hippocratic corpus. So firstly, although drug administration is often associated with women in Greek culture, nowhere is it explicitly said that the gynecological recipes of the Hippocratic corpus are the creation of women. So we won't find that anywhere. So scholars have just assumed that this is the type of information mothers would transmit to their daughters. And secondly, Helen King thinks that certain types of ingredients that are used in the gynecological recipes may cast doubts on the assumption whereby these recipes were passed down from mother to daughter. So, for instance, would women have chosen to use excrements in their remedies? And excrements appear in a lot of gynecological recipes. So here, I'm sorry, I've shortened the argument a lot, and mine as well, because of constraint of time. But even though she has those reservations, King does not reject the possibility that some recipes might have stemmed from female self-help practices. She simply thinks that the polarization into female and male knowledge is not very helpful in understanding Hippocratic texts. And I agree with all those conclusions, and I'm sorry I had to rush through them. But what I really want to say in the context of this panel is that scholars studying the Hippocratic corpus have, I believe, exaggerated the importance of pharmacology in the gynecological treatises, and more importantly, they have downplayed the importance of pharmacology in other Hippocratic texts. There are numerous references to pharmaca in non-gynecological treatises, and there even are references to recipe books that are called pharmaketides, which contain both what we would classify as pharmacological recipes and dietetic prescriptions. Unfortunately, these non-gynecological recipe books are lost. So the fact that scholars have exaggerated the role of pharmacology in Hippocratic gynecology and downplayed the role of pharmacology in Hippocratic general medicine may appear innocuous, but in fact it has rather pernicious consequences. So, as we have seen at the beginning of this paper, at some point in antiquity, medicine was divided into three branches: surgery, dietetics, and pharmacology. In Celsus's opinion, dietetics was the most prestigious branch of medicine, the one that deserved to be treated first and most of and at length. And many modern scholars follow Celsus in seeing ancient dietetics as superior to pharmacology or surgery. And so, for instance, Michel Foucault writes, and I'll read it in French and then I paraphrase: alors que les médicaments ou les opérations agissent sur le corps qui les subit, le régime s'adresse à l'âme et lui inculque des principes. So the body is passive when undergoing pharmacological or surgical treatments, whilst the soul is actively learning when dietetic treatment is used. And then add another text, and I'll let you leave you to read it, but basically this author says that there was stagnation in pharmacology and surgery in the ancient world. In fact, this is completely untrue. We know that there were developments in both pharmacology and surgery, but I think that this author is reflecting, like Michel Foucault, this big dichotomy between dietetics and pharmacology, and seeing dietetics as higher.